Welcome back. Still the 1st of April 2020. It's Wednesday. Now, starting off with news from the United States this morning. Great increase in the number of confirmed cases. Now, this is for two reasons. Firstly, there is a great increase in the number of cases in the United States. And secondly, that more testing is being done. So that's encouraging. The death toll now, it's poignant to note that there's more people have died through COVID-19 than died in the 9/11 atrocities. Dr. Fauci has said that deaths could be getting on for 250,000, up to 240,000 deaths, which is a very sobering number. But he also said that without the interventions, it could top 2 million deaths. So the interventions are making a huge difference in the number of people in the United States that will potentially die from this. So these interventions that are expensive and difficult are saving 1 3/4, 2 million people's lives. Deaths will go up in the United States, there's no question about that. But the mitigation is working, reducing the number from over 2 million to hopefully well under 250,000. The difference is life and death. So these strategies are going to work. First of all, we'll see a reduction in the number of new cases. Then we'll see a reduction in hospital admissions. And then we'll see a reduction in the number of deaths, as long as this is adhered to. The President has said we're in for a painful 2 weeks in the United States, and I fully agree with him. Now, Rodney Brown, I believe, is a preacher of some sort in Florida, I think. And I'm pleased to see he's been arrested for holding mass meetings where spread would be potentially taking place, ignoring the law. It's so disappointing that this happens. You've got Christian groups like Samaritan Purse doing great work building this facility in Central Park, and you've got people like this who are potentially killing people through still holding mass meetings. So glad to see he seems to have been arrested anyway. It's not just Rodney, there's other people in other parts of the state still holding religious meetings. Do not hold mass religious meetings. We are in lockdown and social isolation. That's what we need to be doing. Now, Italy, confirmed cases going up, deaths going up. There's probably a slight levelling out now. We're in the fourth week of lockdown in Italy now. It's been extended to the 13th of April, but the number of new cases is going down. The lockdown works is just such a frustrating lag. As we've said before, it's in the 4th week, but that was because it happened late. If we're proactive rather than reactive, it makes things much easier in the long run. But there was community transmission in Italy before the lockdown, which is why things are taking so long. Now, the United Kingdom, we've had 25,000 cases confirmed, despite the fact the testing in my country is a joke. We're not testing anywhere near enough. Friends who are nurses and doctors can't get tested. They're off work, but they can't get tested. This is just ridiculous. Someone needs to get this sorted out. The government are aware of it, the government have admitted it, and I'm really hopeful they are going to sort it out. Quite why there's so little testing in my country, I'm not really sure. Chemical companies have said reagents can be there. I really don't know what's going on, but let's hope it's fixed soon. And remember, we need the antibody test as well as the antigen test. Let's get them both rocking and rolling as soon as we can, please, authorities in the United Kingdom. Deaths are going up. This number, this daily increase in that's 24 hours, an extra 393 deaths. This will increase over the next week. It will increase. Hospital admissions have increased since yesterday and will go on increasing for the next few days to the next week or so. But hopefully the lockdown will start reducing the number of cases. Then there'll be a reduction in the number of hospital admissions. Then there'll be a reduction in the number of deaths. But for now, they are going to go on increasing. Now, so upsetting. 13-year-old boy died in London. Apparently he had a cardiac arrest after being infected with COVID-19. Terrible. Youngest case in the UK. As far as we know, he was fit and well. The family may choose to release his medical background. It would be useful to know. But as far as we know, he was fit and well. Now, this isn't terribly surprising. It's tragic, but it's not terribly surprising because we've looked at the Imperial College London figures for the people under the age of 30 who can die when they contract this infection. And it works out that about 3 out of 10,000 who contract this infection under the age of 30 will die. So these cases, the 19-year-old man, the 13-year-old boy that died, there are going to be more of these cases, but they are the vast minority of the fatalities. The vast minority. So I think the Imperial College London figure was 0.03 case fatality rate. So 3% will be in 100, that would be in 1,000, that would be 3 in 10,000. So that's what can be expected in terms of case fatality rate under the age of 30. So we are going to see these. But in the study we've just looked at, I think in over the age of 80, it was 8.4% in China. So we've got 0.03% as opposed to 8.4%. The risk is increasing with age, but we can expect more of these younger deaths, which, while tragic, are anomalous. We're doing 8,000 tests a day. It's just lamentable. Spain, again, is not getting enough testing done. So in Spain, we've got 102,000 cases confirmed. The real number is probably 10 times that. I'd be amazed if it's not well over 1 million in Spain. Great increase in the number of deaths yesterday in Spain, up to over 9,000 now. That was the largest loss of life for 24 hours. It will come down, but it's going to take a little longer. Let's hope Spain's nearing the peak now. It's even higher than that, actually, because people are dying at home as well. It's estimated that maybe another 20-30% of people could be dying at home as a result of the COVID-19 disease. So there was 7,700 new cases over 24 hours. But that was a reduction. The 24 hours before that, it was 9,000 new cases. So that was the number of new cases yesterday. That was the number of new cases the day before. So this is what we see at first. The rate of increase decreases. So hopefully, with the effects of the lockdown, tomorrow we're going to see about maybe another 6,000 cases. Then it will go down to maybe 5,000 cases, till it goes down to no new cases as the effects of the lockdown start to take greater and greater effect. So it looks like we're seeing a reduction in the increase now in Spain. As we've said, the hospital admissions and the deaths are going to take longer to feed through because of the up to 14-day incubation period and the fact that people are typically admitted to hospital in the second week of the illness, and people that die often die 2, 3, 4 or 5 weeks after the onset of the illness. Patients that aren't responding to oxygen are being treated with morphine as a palliative. This is a terminal care pathway. And there's some people are saying that over 80s aren't being intensive care treated. In Catalonia, others have said that's not true, so I don't know what the actual position on that is. But of course it's true that intensive care should only be used when people can potentially benefit from intensive care. And we've already looked at data from London that's shown that people, especially older people, can be on ventilators for more than 2 weeks. And it can be very difficult to get them off. So ventilators are not a panacea. It's not that you get cured if you're on a ventilator. Ventilation is a very high risk medical procedure, only for the sickest people. And many people that are ventilated, unfortunately, do go on to die. Now, Belgium, quite a lot of confirmed cases, fair few deaths. Again, this will probably not represent an accurate case fatality rate. it will turn out to be, at a rough guess, that's probably about 8% there. So no, it's less than that. It's about 7%, 6 to 7%. But there's a lot of cases in the community that won't be diagnosed. So the death rate hopefully is going to be way less than this. But the numbers are relatively high for this stage in the pandemic, given that things are still increasing, because the population of Belgium is only 14.4 million. And again, very upsetting to see a 12-year-old girl has died in Belgium. But again, these are anomalous. We can expect to see some young people dying, but it's going to be the vast minority of deaths. This is an email I've just got from Belgium. All calm here and people are following the instructions well. Pleased to hear that. No panic buying, which is excellent. We lamented the great wastage of food in my country yesterday, with people panic buying and then failing to eat all the food they'd bought. People are not congregating as government advises. Exercise is fine outside multiple times a day, but as long as you are on the move and on your own or only with people from your household. This has worked well, widespread mask and glove use. So good to see that the Belgian population by and large seem to be complying with these necessary measures. Now, Ireland, just across the water from me, Southern Ireland, Republic of Ireland. For the population, again, quite a few confirmed cases for this stage in the epidemic. 71 deaths. So the Irish did start quite good lockdown procedures at a fairly early stage, which was encouraging. So I'm hopeful that they can contain their corner of the pandemic reasonably well. But we will expect to see deaths carrying on increasing because of this lag that we've already talked about. Iran, again, data's limited from Iran. Official confirmed cases, official deaths. Great to see that France, Germany and the United Kingdom have been supplying Iran with equipment, including medical equipment. As we've said numerous times before, this is no time for politics. People are suffering and dying. We need to help everyone we possibly can. Austria, confirmed cases and deaths again. And mask wearing has been made compulsory in supermarkets for shopping. And this is probably a good idea because they're doing it in Hong Kong a lot and they're doing it in China a lot. And if those places are doing it, then there's probably a very good rationale for it. A mask is not going to protect someone particularly, but a mask can stop an infected person infecting those round about them. Masks can be bad because they can give a false sense of security. They can be bad that when we take them off, their viruses can be flapped around and dropped onto surfaces and infect people. But the Chinese and the Hong Kong authorities believe in them, so that's a good indication that they've probably got data that it's effective. And infected people in supermarkets now are probably less likely to infect those around them because of the mask wearing. And of course, some of the people that are wearing masks in the supermarkets could be asymptomatic potential spreaders of the infection, or even pre-symptomatic potential spreaders. So Hong Kong are using universal masking, and part of the rationale there is that asymptomatic carriers will not be spreading their virus out to other people. So this does make sense. Africa tends to carried on. I've got massive concerns about Africa. Lagos is locked down, 21 million people. Many people very poor. This is going to cause massive hardship because, as we've said many times, often what people eat that evening is what they have earned that day. So great difficulties in Africa. India, very similar situation. Now, having criticised this church in Florida, we now have to criticise this mass Muslim Islamic meeting in New Delhi that went ahead inexplicably, and people lived in cramped accommodation have now diffused to all parts of the country. So all mass religious meetings, I'm not making any religious point, any denominational point, all mass meetings have to stop. Let's not make this mistake again. Terrible that it's been made so recently. There was another meeting in Kuala Lumpur where this happened, and distressing to see these church meetings in the States. Let's hope it's all stopped now. And of course we had all that spread from a religious meeting in South Korea as well. Everyone's free to worship as they choose and can do so online. Churches, now probably mosques as well, I don't know, but certainly all the churches around me are doing their services as normal but online. So you can watch all you want and sing along. That would be wonderful. But do not go to meetings. We have to be socially isolated. Now, Thailand confirmed cases. Now, the reason I put Thailand on today, I saw this wonderful video. And they've got this little test, and it's just like a pregnancy test. It's just like that sort of plastic thing there, like that. And it's got it's got the column there, and you put a drop of blood on the bottom there. So you put your blood on the bottom, just a finger prick test, like that. And if you get one line, you haven't got it. But if you get 2 lines, you have. And this person I saw tested on the video still had a fever. So they were still in the acute phase of the illness, but they still developed a faint second line, indicating that they'd already started producing antibodies. Now that's actually encouraging, because it means the person that had the fever in the early stages of the illness were making the antibodies that they could see on that line. So that's the antibody test there. And the antibodies, of course, are the immune protein that's fighting the infection. So this is good for 2 reasons. Firstly, the doctors could see that this person had the infection, and therefore they went on to do the PCR test for the antigen, the polymerase chain reaction test, and they found the antigen. The antigen, of course, is the virus itself, whereas the test detected the antibodies that the virus had made, or stimulated the body's immune system to make. And basically we need billions of these. Billions of these we need. So the Thais seem to have managed to start making them. They're going to mass produce them. Really, for sophisticated countries like mine, why on earth haven't we got millions of these things already? And as well as that, when we know how many people have got the antibodies, we'll know how many people have had the infection. I'm very confident to predict in my country that'll be about 10 times more at least than the official numbers. But of course, if there's 10 times more people had the infection, then for a given case fatality rate, that's going to mean the case fatality rate is going to be so much lower. So the case fatality rate looks like it's going to be about 7%. And we do these antibody tests and we find out 10 times as many people have the infection as we thought. That would take that down to 0.7. Still terrible, but certainly a lot better than 7%. So we can't get these soon enough. And as well as that, for example, I was talking to a friend of mine who was a nurse yesterday, and she had the infection, almost certainly. But we're not sure. You can't diagnose it purely on the clinical features. You can have a very good guess, and the very good guess is that she has got it. But we could only confirm it with a PCR test for the antigen, which she hasn't had. But if we had the antibody test, we could show that she'd had it when she's better next week, and that means she can go back to work, and we believe she won't get it again, nor will she infect her patients. She'll become a superhero, a super useful person, because she's had the infection and has developed her own immunity to it. So let's get billions of these things, and let's, I don't know, ring up Thailand, find out what they've done and copy them all. Let's get millions of these things online so we can start getting on top of this. Test, isolate, quarantine, treat. This is what we need. This is the next major weapon we are waiting for in the fight against this pandemic. And as we get more testing, we can start to ease at some point, hopefully next month, the lockdown. Until then, until we get the testing, it's hard to see how we can for a longer period of time anyway.